Greetings, everyone. Welcome back. So this is our last modality that we're going to talk about, that we're going to be introducing to you in this module, and it's called Cranial Sacral Therapy. We're going to start off this presentation with a video by Tad Wanvier, who's going to give you an idea of what cranial sacral therapy is. And then we have three lovely ladies that are going to talk to you about the therapy and maybe talk about their perspective from their individual practices as well. So we have Judy Bolton, Lisa Bercegeay, and Susan Jones, okay? So what we're gonna do is I'm gonna start the video and then they're gonna just chime in after the video is over and start speaking to you guys, okay? Enjoy.
Hi, I'm Tad Wanvier. I specialize in craniosacral therapy. I'm often asked two questions. What is craniosacral therapy and how does it work? What is craniosacral therapy? Craniosacral therapy is a light touch manual therapy that focuses on improving the structure of the body, in particular the central nervous system, so that the body as a whole can work at its highest level. How does craniosacral therapy work? We can think of the body as an interrelated and interwoven biological fabric, so that if any part of the fabric is twisted, pulled, imbalanced, it will affect the entire body in some way. Here's a drawing of the body. We'll dissolve the front part of the body, and now we'll see the body as though it is fabric. Let's see what happens when a portion of the fabric is twisted. Notice that the twist affects the local area, but it also twists the entire fabric in some degree. Now we'll look more closely at the central nervous system. The central nervous system is surrounded by the craniosacral system. We'll see the body again. The body fades, and we see the skull, the spinal column, the sacrum, and the coccyx. We'll now fade those, and within those bony structures is the craniosacral system, which we're looking at now. Now we'll fade the craniosacral system, and we'll see that it houses the brain and the spinal cord. Everything we feel, think, remember, or do is processed through biological structures. When a structure is overly strained, then its ability to do its work efficiently and fully is often compromised. This can lead to ill health. As an example, let's look at an enlarged section of the body, showing some of the structures as an interconnected biological network. Notice the shoulder stress that has taken place. This can lead to conditions such as difficulty breathing, frozen shoulder, bursitis, tingling or weakness in the hand or arm. There's also a distortion of the craniosacral system surrounding the spinal cord. This can cause stress to the nerve roots and spinal cord tissue that can lead to difficulties such as chronic pain, lung congestion, or difficulty swallowing. As the pattern progresses, it's affecting more of the spinal cord, perhaps causing trouble speaking or moving the tongue, temporomandibular joint syndrome, ear congestion, or ringing in the ear. The craniosacral system encasing the lower part of the brain is also affected. This can lead to conditions such as difficulty moving, migraine headache, chronic stress or fatigue, or constipation. Now more of the brain is affected. That can cause issues like difficulty seeing, concentrating or planning, poor memory, or hypersensitivity to sound, touch, smell, sight, textures, or temperature. The focus of craniosacral therapy is to use light, gentle methods to help the body lessen structural strain so that our biological network can work at peak levels. This helps to improve our ability to heal and function fully at our optimal level. It's been a pleasure sharing this information with you.
My name is Judy Bolton. I'm a cranial sacral therapist here in New Orleans. I have over 20 years experience practicing cranial sacral work, and here in New Orleans I practice under my Louisiana massage license with cranial sacral therapy as my primary modality. My cranial training, as well as Lisa and Susan's, is through the Upledger Institute in Florida that was started by osteopathic Dr. John Upledger, which is now included under an umbrella of the International Alliance of Healthcare Educators. They also do trainings in visceral manipulation, lymph drainage, neural manipulation, and other osteopathic modalities with courses held throughout the United States and the world. I often am a teaching assistant with them, and I have a study group here open to students of Craniosacral 1 and 2 level trainings through the Upledger Institute or International Alliance of Healthcare Educators. And I'll put my information up at the end of this. Let me share this. You just saw this video explaining craniosacral therapy, but this is a diagram of inside the body with the bones of the skull, the spine, and the sacrum, hence the names craniosacral therapy or the cranial sacral system. Inside of these structures are the meningeal layers of elastic, semi-elastic, durable material that create a system full of fluid that has a pressure and a rate that flows inside the brain and spinal cord, filling with cerebral spinal fluid and reabsorbing into the brain the cerebral spinal fluid. This rate of flow is consistently about 6 to 12 cycles per minute. It may have slight variations for each individual and in certain instances, but it's a predictable, measurable flow similar to pulse, heartbeat, even a breathing rate. You can feel this as sort of a filling or expansion of an area. Often the head is pretty easy to feel it on, of about 3 to 4 seconds, and then a pause, and then a reabsorption of about 3 to 4 seconds and a pause. This filling and reabsorbing is something that you can feel on yourself. It uses, I'm going to stop the screen share. So you can feel this rhythm on yourself. It takes practice, but it's worth practicing. You can feel it on your head. You just put your rest your arms on the table, and you can feel it at your head. When you feel it anywhere on your body or anyone else's, what you want to do is get in position and then lighten your hands up. You can even feel this off the body a little bit. And what you're trying to feel for is this very subtle respiration, almost a breathing rate inside the head. Remember, it's a 1, 2, 3, pause. 1, 2, 3, pause. 1, 2, 3. You get the idea. So this rate continues when we're asleep or awake. You can feel it in any area on the body. Some people have a easier time feeling it on the head. Some people have an easier time feeling it in other places. You can also feel it on your thighs. If you're sitting in a chair, you can put your hands on your thighs, and you can feel that movement in that way with the legs in and out. this respiration, the cranial sacral rhythm, it takes time and practice and a very light touch to feel. The touch is about the weight of a nickel. So if you have a nickel, you can take that and see, what does that feel like? It's hardly any pressure at all. Feels a little bit different on the top of the hand, whoops, on the ground, on the front of the hand or the fingers. But if you're thinking of that level of pressure when you hold your head or work with the legs, you'll be in the right level of contact to feel this rhythm. This helps. Let's see, I'm going to go back to that screen again. Working with that light touch, the practitioner releases restrictions into soft tissues around the central nervous system. The light and pressure of this work is very deep, and it restores balance deep and around the brain and spinal cord. And also in the brain with the membranes of the falx and the tentorium. These are all components, part of this cranial sacral system inside the brain. You can see some of the diagrams through this. A cranial sacral practitioner, through this very soft yet very profoundly deep technique, can release tensions in the head and spine that can cause a variety of problems. Concussions, traumatic brain injuries, migraines, headaches, chronic neck and back pain, brain and spinal cord injuries, ADD, ADHD, autism, stress, tension-related disorders, TMJ, PTSD, chronic fatigue, fibromyalgia, anxiety, vertigo, tinnitus, scoliosis. You get the idea. It deals with a lot, addresses a lot of conditions in a very deep way, surprisingly deep for the level of pressure, and it's actually the deepest work that I've ever found. It helps the body to self-correct by bringing it back into balance to heal itself. Here's my website, and feel free to go to Cranial Sacral New Orleans if you want to know more about me. And my name, again, is Judy Bolton. Thank you.
Thank you so much, Judy.
All right, I'd like to introduce myself. My name is Lisa Bercegeay. I've been a licensed massage therapist for 11 years. And I basically take my past experiences and incorporate it with the work I do. And you know, I thoroughly enjoy the work I do. And I'm going to share some pictures with you so you can kind of get an idea of my practice. So I'm going to go ahead and do that now. Here we go. So like I was saying, I've been a licensed massage therapist 11 years. Previously, I did 20 years in Louisiana Army National Guard, and I'm also a current VFW member. A little background information about me. And LSU graduate, and also a teaching assistant with the Upledger Institute for Cranial Sacral Therapy in Florida. I also do presentations with Dr. Karen Danton at various libraries. We've been to BNI groups and Our Daily Bread. We did a presentation there. So I'm going to show you some quick pictures of myself. This is myself in Afghanistan, 2002. And also another picture when we did our Veterans Memorial Day Park 21 gun salute. That was in 2009. And the next picture, these are some influential people in my life. On the left, Dr. Coleman, Dr. Richards, they're both chiropractic doctors. And there's myself and Dr. Danton at Nature Sunshine Conference learning about essential oils in Indianapolis. And she refers the most patients to me, Dr. Karen Danton. And also I get referrals from the chiropractic doctors. And on the right, this is one of my favorite patients. This is Chico Garcia. He was an LSU cheerleader. and cheerleader coach. After the accident, he was rendered quadriplegic. So we do cranial sacral therapy work with him to get the fluid moving down the dural tube, and we're working on regenerating those neural responses, because he's also at the same time receiving stem cell injections and physical therapy to prevent muscle atrophy. So he, just an amazing client. He's been through so much, and we're just working to get him back more movement past C4. And this next slide. So this is where my treatment room is. 2.5 years ago, Dr. Danton invited me to her office to practice at her office. I am independent, self-employed. And this is a picture of my office located at Dr. Karen C. Danton's practice. And when clients come in, this is how they're positioned. We have them, just comfortably placed on the table. You can leave clothes on, just remove all metals. It's such a gentle therapy, but so extremely profound. So in this particular picture is a demonstration in Denham Springs. So we're just feeling the cranial flow, the cranial movement, the cerebral spinal fluid, and just feeling temporal bone to temporal bone in the structures within, as Judy explained earlier. I'm going to show you some really quick pictures of the fluid flow through the brain via the meninges and the dura model that holds the fluid. So basically moving lymphatic to lymphatic, just opening up the structures so the cranial nerves can function better. Good fluid flow from lymphatic to lymphatic. We also use a piezoelectric effect at the spine just to connect into the client. Because you want a nice open circuit. I'm going to go back to this slide. So let's say if I'm under the cervical spine, one hand under the cervical spine and one hand below, you basically feel that motor nerve connection. It's like an open circuit. So you want a nice open circuit for that motor neuron connection. And where that nerve terminates, you want a nice open circuit so everything functions well, sends a message to the brain and back. Again, working with the central nervous system. And when my clients come in, I'd say about 50% of my work is cranial sacral therapy. I'm like, look, you want to work with the central nervous system today or the peripheral nervous system? So the other modalities I do is the hot stone massage, working hot stones, and they literally melt. People come in with what I call boulders in the shoulder and just a lot of tension. Sometimes we'll just start with the hot stones or relax the muscles, and then go into cranial sacral therapy, or I'll do a full cranial sacral therapy. I also do neuromuscular massage and stretching. But this is my most profound work, is cranial sacral therapy. And of course, it's named after the fluids and tissue that support your central nervous system. I had some injuries myself when I was in the military, and some somatoemotional issues, which, we do attach a lot of our emotions with areas in our body. Like a lot of times I'll have clients come in with jaw tension, and that's where they hold their stress. And with cranial sacral therapy, I can get into the TMJ joint and do advanced work that we're taught at the Upledger Institute via cranial sacral therapy. And we can release the tensions, and a lot of times the emotional aspect will come out as well. They'll either, a lot of times remember falling or hitting their head, something that caused the jaw to be malaligned. And that comes out too. When they recognize the issue, the emotional aspect of it, it's easier to treat it. They'll acknowledge the emotional aspect as well as the physical. And it, it's more easily to, we're able to more easily connect, work with the central nervous system when the somatoemotion release comes out and we get into the tissue. And like I said, I was in the military, so a lot of so cranial sacral therapy has helped me as well. I get on the table at least once a month myself. So I live this life. I do cranial sacral therapy, and I know how it has affected me. And this is my main modality that I do, that I receive. So with being in the military, I did have some emotional things connected. I had a little anger in my liver that I had to recognize, to come out. And then this therapy has also helped calm my central nervous system via the vagus nerve. So my heart rate calms, when I'm receiving treatment via the vagus nerve. I'm able to just kind of release the emotions and just allow the body to, the body is a self-healing mechanism. And while you're working with this central nervous system, all the parts, the emotional aspects, the physical aspects, everything comes together during the treatment. And I do have a list of, some of the main things that craniosacral therapy does treat, especially with the stress. People come in with PTSD, and it does help with ADD. It does help calm the mind. Scoliosis, migraines, TMJ is a big one for me. A lot of people hold their somatoemotional in their temporomandibular joint, and really it's amazing work for that. Helps release any malocclusions. A lot of neck and back pain and dural tube strain patterns. When we release the dural tube strain patterns, it helps the whole central nervous system flow better. The cerebral spinal fluid flows better, everything operates. So you're making those neural connections. So again, we're treating the central nervous system with cranial sacral therapy. And I just want to say again how much I love the work I do. And there's so many modalities out there. And a lot of things I incorporate with the cranial sacral therapy. I also incorporate the lymphatic movement, visceral work, as Susan will go a little more into later. Just so many different aspects, even breathing techniques when I'm working with the vagus nerve, also known as a wandering nerve, to help calm the heart rate and everything that cranial nerve area affects. So again, and my practice again is in Baton Rouge. I'm with Dr. Karen C. Danton in her office. She's an integrative medicine board certified family practitioner. And thank you for these. Thank you for inviting me, and I wish you all at Unitech a wonderful day and peace, and remember to breathe and stay calm during these times. And thank you. I'm going to turn it over to Toshii.
Thank you so much, Lisa. I really appreciate it. Thank you. And we're going to turn the floor over to Miss Susan Jones. Thanks, Lisa.
You're welcome.
That was awesome. This is awesome, you guys. I love it.
All right. Hi, my name is Susan Jones, and I'm the owner and lead therapist at the Muscle Manipulators LLC in Baton Rouge, Louisiana. I chose that name for my business because it's a play on the definition of massage therapy, which is the manipulation of soft tissue, including muscles. My client base is mostly regular folks who stay active, but while I competed in powerlifting as a hobby for a couple of years, I got to network with a few personal trainers and strength athletes, so I see a good bit of those. I've also developed a good relationship with these trainers by giving them discounted fees in exchange for client referrals. And because these trainers are seeing people with more expendable incomes, networking with them has helped me to go from seeing 10 people in a spare room in my house for $65 an hour to renting an office and seeing 30 people a week for $100 an hour or $150 for 90 minutes. These trainers recommended me, but it was my job to keep the clients coming back or sending me new referrals. With this networking technique, I've been able to sustain my business with very little marketing and a lot of word of mouth referrals. My specialty has been neuromuscular and sports massage for the majority of my career, which is over 17 years now. And for 7 of those years, I was a massage therapy instructor. I started studying craniosacral therapy about 7 years ago under the recommendation of another teacher that was teaching me visceral manipulation, which is working with the organs, to help me to be more effective in palpating these deeper tissues without needing to press so hard. At first, it was incredibly difficult because it was a foreign concept to me. I was used to doing assessments on posture and movement, and everything being about muscles and bones. Basically, it was my job to correct the body's imbalances through the manipulation of the soft tissue. Craniosacral therapy showed me that it was not necessary to pummel someone's muscles to get their body to respond, that the body was way more complex and that there was way more information to be gathered in the assessment process. I also learned that it was my job to listen to the body and follow its leads, because I couldn't possibly know more than the body itself why it chose to bend or twist a person, causing an imbalance. Maybe the body had a good reason, and it wasn't just due to a choice that the person was making. Now, even with the limited understanding of the techniques, just kind of sprinkling it with other techniques, I was seeing a very big difference in the tissue response to the work. One case that I remember was a woman that came in complaining of carpal tunnel syndrome, which affects the wrist and hand. And I asked her if she would let me try something that I was learning that might help. I did my craniosacral therapy assessment and found that she had some restrictions between her wrist and elbow. So with a very light pressure, like has already been mentioned, about 5 grams, I just held her wrist and elbow for a few minutes and felt how the tissue moves subtly. And out of the blue, this woman just says, "Oh my gosh, I just remembered that I broke my arm when I was 7. And right as she starts to say that, I felt the restriction release. Now, in NMT, usually getting lasting results from carpal tunnel would take me about 4 visits. So after doing some massage techniques to follow up with the craniosacral therapy, I scheduled her to come back. And she calls me a few days before her next session to let me know that she doesn't have any pain anymore since the first session, and that she wanted to ask if it was a good idea to cancel her appointment. So I let her know that I was happy to hear she was feeling better, and she should see how long that lasted and give me a call if she feels any more discomfort. It's been 7 years and I'm still waiting for her call. One of my friends this morning reminded me of her favorite session with me. She lives in Rhode Island, so I haven't seen her in a while. But she mentioned that her first time receiving craniosacral therapy, she walked into my office wheezing from asthma. And she left the office breathing normally and not having an asthma attack again for months. So craniosacral therapy is amazing in so many ways. But one of my favorite craniosacral therapy experiences have been taking the classes. And when we took Craniosacral 2 class, our instructor spoke of a former football player named Ricky Williams, who I remember played for my home team in Miami, Florida, but also I believe played for the Saints for some time. And Ricky Williams suffered many different symptoms related to all these compiled physical traumas to his head and body from many years of playing football. After seeing craniosacral therapy being used in the locker room, he started receiving craniosacral therapy regularly, and it brought him so much relief that he decided to actually become a craniosacral therapist himself. So he's a massage therapist now, guys. And he's also sponsored now, I believe, 2 in-depth studies for former and current football players suffering from traumatic brain injuries and physical and emotional ailments as a result of the effects of football on their body. So what's on the screen now is a poster of the results from the study, the first study they did, and we'll include the link so you can take a look at it later. But some of the changes that they felt as a result of receiving craniosacral therapy and other subtle body modalities like visceral manipulation and others were less pain, improved mobility, better sleep, less mood swings, relief from tinnitus or ringing in the ears, less anxiety, better general quality of life. And the most remarkable part was that they continued to improve for months after the study, even though they weren't receiving any more care. It's like you wake up a little something and the body just rolls with it and it starts working on repairing things. So the idea that a gentle touch, as light as the weight of a nickel, could have such a profound change in the body was incredible. The next class that I took was somato-emotional release. And here we explore the effects emotional trauma has on the soft tissue. This was amazing as well. How can something that happened to you as a child or a long time ago that you wouldn't consider a big deal cause your body to hold tightness in a certain area, block circulation of blood and nutrients, and restrict movement? Even more remarkable, how can having a memory of the event, feeling, or disappointment release a lifelong restriction and restore healthy movement and circulation to the same area and resolve pain and dysfunction? Because of these amazing things, I've incorporated the craniosacral therapy assessment with every new client, and I usually combine CST techniques with other modalities. It's much more profound in its effects than just massaging the soft tissue. The effects are also more long-lasting and in many occasions resolve pain and dysfunction without intense pain for the client or a big physical demand for us, the therapists. I really love how it's helped me to be able to feel more connected to the body, as if I can now hear it speaking to me and guiding me where it needs me to go for the best outcome for the client. This is especially beneficial when a movement pattern is off for one of my lifters, and after all NMT work that we're doing, nothing is changing. Clearly, we're missing something. So craniosacral therapy helps me to use different tools to find the root cause of these issues. For example, working the abdomen to relieve shoulder pain, or the shoulder to relieve restrictions in the ovaries, tailbone, or the knee. Now, instead of wasting time, I start with these assessments and just go with what I'm feeling, even if it seems not to make sense at first. Allowing the body to tell me a story and take me on a journey to show me what it needs has not only made my practice more interesting and exciting, but it's gotten the best results for my clients and keeps me very busy and productive in my practice. Combining techniques like craniosacral therapy with neuromuscular and sports massage gives me a more well-rounded and detailed approach to help the client get to a resolution of their problem. This understanding is especially wonderful and helpful when the client can't speak, like in the case of a newborn baby. I recently became a great aunt for the 6th time, and when I went to visit baby Camila, she was having trouble latching onto breastfeed. Apparently, the pregnancy had been a tad stressful for mom because she had gestational diabetes. And while the baby had some tight TMJ muscles, she also had some potty issues. Using gentle NMT techniques inside the baby's mouth, along with craniosacral techniques, I was able to help her latch onto feed. And then doing some more craniosacral techniques, one technique in particular called positional release, I was able to help her relax by following the movement her body was missing, floating in the womb. While I held her occiput and sacrum, she twisted and bent and rolled and flipped upside down. And when she was done, after about 30 minutes, she stretched out, opened up from the fetal position, and she was sticking her tongue out as if she had just discovered that it could do that. In short, this is important because the tube from your mouth to your anus can be restricted by continued fetal posture, causing difficulties feeding. Because the tongue can't move enough and the esophagus can get kinked, this can also cause issues digesting food, which gives babies colic and reflux. But in a few hours after we did this work, she was a happy baby. She had a very big poop. She filled 2 diapers and made a mess on the changing table. This helped her to eat more, gain some of the weight she had been missing due to the mom being a diabetic during the pregnancy. Now, I'm not a person that just believes things. I need explanations and factual evidence to accept modalities as solid, so to speak. I love that craniosacral therapy has provided that for me because I'm not comfortable with techniques that seem to claim a lot with very vague backing for the why, or that ask you to just believe. I'm a therapist that needs to be able to see how things connect logically, and they have to correlate to the anatomy and the physiology of the body, and it has to work no matter what the person believes. So if you're looking at craniosacral therapy and thinking it's mumbo jumbo wiki woo, delve into the information in the books, look at the data, and see for yourself. If you'd like to know more about me, my website is www.themusclemanipulators.com.
Thank you so much, ladies. This was awesome. I am really at a loss of words. This was phenomenal, and I know my students would appreciate this presentation. This was phenomenal. I just want to thank you so much on behalf of them. This was so awesome. I encourage you, to my students, I encourage you all to, if you have any questions, to reach out to these ladies. If you're in the Baton Rouge area, you want to try to get a session, or you want to refer friends in the Baton Rouge area here in New Orleans, please do so. With that, I am going to go ahead and say goodbye for now, but I'm going to ask my guest speakers to stay on the line with me, please. Okay. Thank you so much.
Thank you.
Good luck.
Yay.